Thank you to everybody for attending. I'm really excited about this topic. It's proven popular in past Q&As, and I'm looking forward to sharing some important information that hopefully will be valuable to your daily life. So, we're going to start off with how we say it. It's a popular topic. I hear it almost every day in the office. And you'll find that hearing professionals like audiologists, ENTs, physicians, healthcare providers, and researchers will all say tinnitus. But most of the people that we encounter in our daily life outside of work, lay people, patients, people in the community say tinnitus. Neither one is more right or wrong than the other. It's just that tinnitus is what you'll hear whenever you listen to a medical professional talk, or if you're listening to recorded videos or podcasts by medical professionals, audiologists, and people in healthcare. Tinnitus is extremely common. It's experienced by more than 50 million adults in America, which is about 15% of our population. And it's an estimated that 1 in 7 people worldwide experience tinnitus. Roughly 5 million people in the United States struggle with burdensome tinnitus, which means that it's something that affects their life on a daily basis and has some debilitating effect. And while 2 million people find it debilitating, 90% of the people with tinnitus have hearing loss. And there's an economic impact, which in the United States is over $26 billion a year or $660 per person receiving healthcare services. What is tinnitus? It's got some wordy and lengthy descriptions, but basically it's a sound that you can hear in your head that's in absence of an external sound source. It's typically described as a ringing, hissing, whistling, clicking, buzzing, whooshing, swooshing sound. And for some people, it also can sound like music or an indistinct talking or voices, kind of like a conversation you can't understand. It's thought to be the result of abnormal neural activity and connectivity in the auditory and non auditory pathways, and that causes the brain to interpret this abnormal neural activity as a sound that cannot be heard outside of your head. There are a variety of causes for tinnitus, and we're going to touch on a few of them today. It can be something as simple as age and hearing loss. There can be diseases and disease processes associated with tinnitus. Noise exposure can cause tinnitus. I'm sure many of us can remember attending a concert in college or high school or as young adults where you walk out of there and your ears feel blocked and you have the loud ringing in your ears, and that's a temporary shift in your hearing as well as temporary tinnitus related to the noise exposure. Some medications can cause tinnitus. Sometimes a head injury or traumatic brain injury can result in tinnitus. And then there are unknown reasons for the cause of tinnitus. Some people have it and we don't always know why. The source of the tinnitus can be located in the cochlea, which is the inner ear. It's shaped like a snail shell and has thousands of hair cells inside of it. And when those hair cells get damaged, particularly by loud sound or the aging process or ototoxic medications, which are medications that can damage hearing, those hair cells are damaged and that can lead to tinnitus. Tinnitus also can originate along the auditory pathway, which is um, your neural pathway, and it can originate in regions of the brain. In people with tinnitus, they can sometimes see a reorganization of how the brain maps sound and interprets sound. There can be an increase in neural synchrony, so how the nerves are firing together that can cause tinnitus. And you can also see an increase in spontaneous neural firing within the brainstem that can result in the perception of tinnitus. So it's a pretty complicated process. It's not something that you can diagnose with imaging or like a CAT scan or an X ray. It's really something that's diagnosed by symptoms, taking a medical history, and having a hearing evaluation. So the interesting thing is that your brain is actively involved in the process of perceiving tinnitus. When you have normal hearing, your brain tunes out a lot of sounds for you. There's a lot of low-level environmental sounds that your brain you hear, but your brain dismisses, and it can be things like the ticking of a clock, or low level background noise from the fan on your computer or the refrigerator, or even things like leaves rustling outside, a dog barking. Your brain registers those when you have normal hearing, but it doesn't put attention on them. When you have hearing loss, what happens is that your brain has to pay more attention to all sounds because it doesn't know when a sound may be important to the understanding of speech or safety in your daily life. So your brain basically goes on high alert when you have hearing loss and starts paying attention to more things and filtering out less. And so, as part of the hearing loss process and your brain not filtering out sounds the way it used to, it also can perceive the tinnitus because it's not filtering out that extra neuron activity that's happening in relation to the changes that have been caused by your hearing loss. Another interesting way of interesting information about the neural pathway and how the brain travels from your ear up to, or how the sound travels from your ear up to the brain, is that it's a two-way process. The sound is picked up by these little hair cells in the bottom right corner in your cochlea, your inner ear, and it's sent up the auditory pathway to the brain, where the brain interprets the sound. But the brain also sends signals back down the auditory pathway to the hair cells in the cochlea. And it's kind of like what happens is that the brain sends a signal down to the hair cells that says, "Hey, are you still there? Everything's good. Nothing big is happening." And the hair cells send a signal back through the auditory pathway saying, "Yep, we're fine. There's nothing to hear. It's silent." But they have this two-way communication going on, an afferent and an efferent communication. And when you have hearing loss and those hair cells are not working as well as they should, then they may not send the signals to the brain that say, "Hey, we're here. Everything's fine. There's just no sound to listen to." And they may not recognize the sounds coming back from the brain that says, "Okay, I'm just checking in, make sure you're all okay." And so it's this uncontrolled feedback loop that can generate the tinnitus that you hear in your head. So when you have normal hearing, as I was saying, this is just a bar graph that kind of talks about how often in someone with normal hearing that you can see a spike in the neurons from activity going between the ear and the brain back to the ear. But when that's happening, you have normal hearing, you don't hear tinnitus, you just hear silence. You can have hearing loss without tinnitus, and that happens when your brain is not disturbed by the lack of communication at the level that was happening before. And then you can have tinnitus, and you can see actually an increased signal and activity between the brain and the ear. And what's happening there is the brain is not getting the response back from the hair cells in the cochlea. So keep sending those signals saying, "Where are you? Where are you? Where are you?" And when it doesn't get the response back from the hair cells in the cochlea, then it generates a sound that you perceive as tinnitus. Tinnitus can have a variety of characteristics. It can be temporary, such as a noise-induced tinnitus from that concert, or it can be persistent, which means that it's there all the time or most of the time. It can be constant, intermittent, and pulsatile, meaning that it pulses like with your heartbeat. You can have tinnitus in one ear, both ears, and it can be the same in both ears, or it can be asymmetrical in both ears, meaning the sound quality can be different or the volume can be different between your ears. As I said earlier, you can hear ringing, humming, roaring, static, whistling, buzzing, music, and voices. And the tinnitus can change in volume throughout the day. There may be parts of the day that you don't notice as much as other parts of the day. Sometimes tinnitus is associated with a blocked sensation, and tinnitus can be related to a known cause, such as loud sound exposure, ototoxic medications, or ear disease, hearing loss, and sometimes is present without a known cause. One of the big impacts of tinnitus on most people who have it is in their quality of life. In some people, it can disturb their sleep. It can affect their emotional state, causing an increase in stress, anxiety. If they have PTSD symptoms, it can make that worse. Insomnia, sleep deprivation, it can affect concentration. All of these factors can contribute to increased fatigue, and we sum this up with something called the tinnitus burden. And basically, that is assessing how much this affects the quality of your life and your daily function. There are some great questionnaires that assess the tinnitus burden, and I just have a few of them, parts of a few of them for you to see. They're available online for you to take at your leisure. But it looks at things like, is it difficult for you to concentrate? Does it make it difficult for you to hear people? Does it cause you to feel angry, anxious, confused, desperate? Is it something that causes you to report it and talk about it, complain about it? And does it affect your sleep? This is another tinnitus questionnaire called the functional index, and it looks at things more specifically like how often you're aware of your tinnitus, how loud it is, how often it annoys you. Do you ever feel in control or out of control with the tinnitus? Are you able to cope with it? Can you ignore it? These are just a few of the things that we look at when we're assessing someone's tinnitus and how it affects the quality of their life. Another questionnaire is the tinnitus reaction questionnaire. And again, it looks at feelings. Does it make you angry, irritable, tense, unhappy? Does it cause you to avoid certain situations? Does it affect your social life? And then tinnitus can also be associated with medical conditions. There are roughly 200 medical conditions that are associated with tinnitus: hypertension, which is high blood pressure, TMJ, which is a problem with your joints. And if you have TMJ problems, sometimes people will report they can hear brief bursts of tinnitus when they chew, or if they press on the side of their face in a certain place, they can elicit a little burst of tinnitus. And in situations like that, you want to work with your dentist and sometimes also a physical therapist. Meniere's disease is a disease of the ear that can cause vertigo, hearing loss, and also a roaring tinnitus. Age-related tinnitus is most often either a static or ringing, whistling kind of noise. You can have tinnitus, as I said earlier, related to brain injuries. And then it's not very common, but you can have tinnitus related to a tumor on your auditory nerve called an acoustic neuroma or vestibular schwannoma. It's important to seek medical consultation for your tinnitus if you have the following things: unilateral tinnitus, which is tinnitus in one ear; pulsatile tinnitus, which is a pulsing tinnitus; tinnitus that accompanies dizziness, vertigo, or nausea; and any tinnitus accompanied by ear pain or ear drainage. You can start by seeking care with your primary care, and they will most likely refer you either to an ENT or an audiologist for further assessment. So, most people who have tinnitus want to know what can be done about it. And generally, all the treatment options for tinnitus focus on decreasing the burden of the tinnitus. So decreasing how much it affects the quality of your life or is bothersome. And the goal is also to help people live a better, more fulfilling, and productive life, even with the presence of tinnitus. Tinnitus treatment is also focused on the attentional, emotional, and cognitive impact of it. And I just want to mention that there is a placebo effect with some treatments. We'll get into this a little bit more later, but there's research has shown that in humans, sometimes in the research situation, providing when some patients are provided with an actual medication and others are given a control placebo medication, that the placebo effect can result in up to 40% of the people in the study noticing that their tinnitus has improved without an actual medication to make a difference. Currently, there are no FDA approved drugs specifically for tinnitus. Some people use medications that are for stress, anxiety, and PTSD to decrease the burden that tinnitus places upon their daily life. Hearing aid use, for those who qualify for hearing aids and have sufficient hearing loss, can decrease the tinnitus or eliminate it while you're wearing the hearing aids for up to 80% of the people. And generally, if you do receive relief from your tinnitus while having hearing aid use, that relief lasts for a period of time after you take the hearing aids off. For most people, that's long enough to fall asleep. And then if they wake up in the middle of the night, the tinnitus will be back, but it's given them that relief during the falling to sleep period. There are also devices that mask the tinnitus. They look like a hearing aid. You wear them on the ear, but they just provide an alternative noise to basically cover up the tinnitus or make it less noticeable. Less commonly, people will seek cochlear implantation to help with their tinnitus. This is for patients with a significant hearing loss as well as tinnitus. It's not guaranteed that a cochlear implant will eliminate or reduce the tinnitus, but it is often seen that stimulation with a cochlear implant can have a positive effect on the tinnitus. There also are a variety of management techniques that work with the patient in reducing their perception and association of negativity along with the tinnitus. So there's cognitive behavioral therapy, mindfulness-based stress reduction, tinnitus activities treatment, tinnitus retraining therapy, and progressive tinnitus management. This last one was developed by the Veterans Administration, and they actually have a wonderful website on tinnitus and activities and a whole workbook that you can go through to understand tinnitus and reduce its impact on your daily life. Cognitive behavioral therapy is provided by a psychologist. So the patient will work with a psychologist. It's usually a short term therapy. And what happens is that you work with the psychologist to identify the bothersome aspects of the tinnitus and work to develop coping strategies. It also works on decreasing the negative thinking that surrounds your experience with tinnitus. And it can be a very effective tool to help you learn to manage your tinnitus as well as any stressful life situation. Mindfulness based stress reduction is very popular for a variety of reasons and that include tinnitus but are not just related to tinnitus. It combines the principles of meditation techniques, and then is tailored to address the tinnitus. It's designed to decrease the overall stress response and improve emotional well-being and coping mechanisms for living with tinnitus. Basically, it's designed to change your relationship with tinnitus and decrease its negative impact. It does not eliminate or cure the tinnitus. None of these techniques do. There's tinnitus activities treatment, and it has 4 areas of focus that you walk through in a very deliberate process, and it focuses on thoughts and emotions, your ability to hear and communicate, your sleep, and your ability to concentrate, and the flip side to that is fatigue. This was developed at the University of Iowa, and their website at the University of Iowa has great information on this process. It incorporates sound therapy as well, which is predominantly using other sounds to help reduce the impact of tinnitus, such as when you're going to sleep at night using a sound machine or an app on your phone to play a sound. Tinnitus retraining therapy combines counseling and sound therapy. The sound therapy uses a hearing aid like masker to deliver various sounds to your ear to determine what is most pleasing to you that also distracts you from the tinnitus or decreases the tinnitus. It also works towards habituating you towards the sound of the tinnitus and developing an ability to start to tune it out. This process is usually lengthy, on average taking 12 to 18 months, and studies have shown that up to 80% of people report significant improvement for having gone through this process. So this is a little bit more about the Veterans Administration and their progressive tinnitus management program. Um, they have an 82-page workbook that is fantastic. It's available as a free download through their website. And it basically teaches you how to use sound to cope with tinnitus, as well as how to manage your response to tinnitus. It looks at things at like rating how different situations may give you relief from the tinnitus, whether it's a noise machine, environmental sounds that you encounter in your daily life, like listening to bird song, the wind, the rain, even traffic noise if you're in a city or another busy place, or listening to things like music, podcasts, talk radio, or just having a conversation. So I encourage everybody to take a look at this workbook. It's really valuable, and I have patients that have found it very helpful. There are some unproven treatments for tinnitus. Um, I have learned never to say never, because there's always someone that has notes a significant improvement using something that has not been validated through research. But generally speaking, over-the-counter herbs and supplements have not been research validated as having a significant improvement or reduction in the loudness or intensity of the tinnitus. The American Academy of Otolaryngology specifically recommends against recommending herbs such as ginkgo biloba, melatonin, and other dietary supplements and vitamins for persistent bothersome tinnitus. There's another technique called transcranial magnetic stimulation, which also doesn't have research-based evidence supporting improvement in tinnitus. Chiropractic care. And then this last one, I included in diet modification. There's information out there on the internet that talks about how not having nuts, caffeine, salt, or alcohol, or reducing your intake of those can have a positive impact on tinnitus. There is no research based on this, but I will say that there's a fair number of my patients that notice a change in their tinnitus with a reduction in caffeine, salt, and alcohol. So, that's something that may not hurt you to try. And if you notice improvement, great. And if you don't, then you can resume your previous intake levels. There are a couple great websites on tinnitus. The British Tinnitus Association and the American Tinnitus Association are both working towards a cure. I will tell you that a cure is very complicated. And what they've done is they've developed a tinnitus cure map, which is basically a very complicated flow chart on the different processes that may lead to a cure in tinnitus. They're encouraging further research into tinnitus using existing biobanks, which are biological collections associated with sample data. In the United States, we have one with the Harvard cohorts and the National Health and Nutrition Examination Study, and another one called Growing Up Today. In the UK, they have several biobanks as well. Canada does also. And so the biobanks are used by a variety of research institutions and on a variety of topics to try to tease out what is helpful, what is not, what are some of the biomarkers that indicate that someone may develop a certain disease or tinnitus, and just collect increased data on when it occurs, how it occurs, and things that cause improvement. Um, the tinnitus associations also map out knowledge gaps. And so what happens sometimes in research is that you see people repeat research that has also already proven something to work or not work, and not work on the gaps in knowledge. So they're really focusing on identifying the gaps and focusing the research funding towards those gaps. They promote the use of big data processes to reveal patterns and trends. This is basically high-powered crunching of data um, to look at the results collected in the biobanks, and also using AI in tinnitus research. Currently, there is no scientifically proven cure for tinnitus. Um, the search for a cure is ongoing, it is real, and they are working on it wholeheartedly and making progress. There have been several research studies that identify drugs that treat tinnitus in animals, and but when they've moved them over to humans, it has not been effective in humans. And the interesting thing about the animal studies was that they actually behaviorally trained animals to report tinnitus by first playing real sounds that they could hear, and then treating them with an ototoxic medication that caused hearing loss, and the result is tinnitus, and the animals are able to identify the tinnitus based on the training that they had with real sounds. It's very remarkable. And then, as I was saying earlier, research with human subjects has shown a large placebo effect. Up to 40% of the people treated with a non-medical control showed significant improvement in their tinnitus. And sometimes I wonder if the placebo effect is what we're seeing when we see people report improvements with vitamins, herbs, and diet modifications. Um, but whether the change in your tinnitus is a result of the placebo or a result of what you've actually done, I feel like it doesn't matter. It's most important for people to experience that change and feel empowered to live with their tinnitus and incorporate it into their daily life. Some of the resources that, as I previously mentioned, I really encourage you to take a look at are the American Tinnitus Association, Tinnitus UK, which was previously known as the British Tinnitus Association, the VA's website on tinnitus. There are also apps for your smartphone that generate noise. You can search on clinical trials. Mass Eye and Ear out in Boston has part of their website devoted to clinical trials. Take a look at stress management, your sleep hygiene, and meditation apps. All of these things are available for free, and things that you can do on your own to improve the quality of your life. I will say that tinnitus for most people is something that they just learn to live with, and they tune it out like they do other sounds in their environment that are not helpful to them. But for that percentage of population that finds it burdensome or really detrimental to their daily life, it is really important to seek help. And anyone with tinnitus should start off seeking help by talking to a medical provider, coming for a hearing evaluation to find out if they have hearing loss, and if their hearing loss may be associated with their tinnitus, or if there's comorbidities, other things in your medical history that also um, can have an impact on tinnitus. For example, you might have hearing loss, high blood pressure, diabetes, and heart disease, and all those things are working together to have an impact on your tinnitus so that you may be able to change various aspects of your lifestyle. The one thing that I find about tinnitus is that a lot of people feel helpless, but there's actually a lot you can do. And I am always happy to talk about this. This has been an amazing opportunity for me to take a deeper dive into tinnitus and what we can do to help people. And I'd like to invite you to keep an eye out for a second presentation on tinnitus where we do take a deeper dive into the research that they're doing and look more at what you can do to empower yourself to move forward with a better quality of life. We're probably looking at late spring or early summer, May or June. So please keep an eye out for that. Thank you again for attending. I've really enjoyed sharing this information today.
Wonderful, Jean. Thank you for that great information. We do have a number of questions in the Q&A box, and I'd like to remind the audience that if you do have a question, if you type it into the Q&A box, we will get through as many as we can for the time allotted. But again, thank you, Jean. That was really terrific.
Thank you,
The
Sue. I really appreciated this opportunity. It's really an exciting area, and I think a lot of patients don't feel like they're heard when they talk about the tinnitus. And I want to reassure you that there are things that can be done, and we are happy to help you with that. I'm going to take a look at the questions and see if we can get to them and find out what's important to you. Um, One question is about COVID vaccines, and tinnitus. They are still doing research on this. A lot of it is still in the data gathering phase. Some of the early information that we're looking at has more to do with tinnitus following COVID and not so much the vaccine. This is definitely something that I can take a deep dive into during a future presentation. Um, the stats regarding hearing aid use. So there's a question about the statistics I provided regarding hearing aid use and how they might reduce tinnitus. Research has shown that up to 80% of the people who use hearing aids and have tinnitus notice a reduction in their tinnitus to a complete elimination while they're using the hearing aid and for a short period of time after they take the hearing aid off. Someone asked what the term habituate means in the context of tinnitus retraining therapy. Habituate basically means getting used to or learning to live with. The purpose of tinnitus retraining therapy is basically to accustom you to the sound and learn to manage your reaction to it. Another question is the VA workbook available online and is it free? Yes, it is available online and it is free. If you Google VA and tinnitus workbook, it will pop up for you probably in the top 3. Um, and I definitely recommend downloading and taking a look. Uh, there's a question about a list of medications that can cause tinnitus. I can't provide you with a list of medications that cause tinnitus, but I will tell you there are many. And what I encourage you to do is work with your pharmacist and your primary care to explore that, to ensure that your health is managed medically in the most appropriate way. Is tinnitus associated with any health conditions other than hearing loss? Yes, it can be associated with a variety up to 200 health conditions. Common ones are diabetes, high blood pressure, heart disease. There are some ear-related diseases such as Meniere's disease that's associated with tinnitus. There's a question about, will tinnitus worsen over time? So, tinnitus changes. For some people, it actually goes away over time. Some people, it gets worse, although that definition of worse is very loose. Some people, for worse, is defined as louder or more often or a change in tinnitus. They might habituate to a certain sound that they're already having, and then that sound changes and they have to get used to it again. But, a wait to see a hearing care professional generally does not cause your tinnitus to worsen. But if you do have concerns that there's a medical cause to your tinnitus, I would always encourage you to discuss it with your primary care. An example of an ototoxic medication is chemotherapy, and there are also some IV antibiotics that are ototoxic, which means damaging to the ear and potentially damaging to the hearing. There's a question about sinus pressure or allergies causing tinnitus. Yes, sinus pressure can result in tinnitus. So that the sinus pressure can be from allergies. You can have sinus pressure from migraines or other causes, and it can result in tinnitus. Um, Someone asked if there's somewhere we recommend sharing the stories outside of going to a physician. Yes, there are some great online support groups. If you go to the American Tinnitus Association, they actually have volunteers in different states that you can call and talk to personally, as well as they have a hotline where you can discuss your tinnitus with someone. And they will provide information for you to move forward. The American Tinnitus Association is a great resource within the United States. Um, there's another question about hearing aids and tinnitus, and the question is, does using a hearing aid to reduce tinnitus just mean that the aids are amplifying the background sounds so that they become louder and louder than the tinnitus? In a very rough way, I can say yes to that, but really what's happening is that the hearing aids are providing stimulation to the part of the ear that you're not getting enough stimulation from due to the hearing loss. So that it's really the increased stimulation to your ear by hearing better, not necessarily by covering up the tinnitus. And that looks like most of our questions. I really appreciate all those thoughtful questions. And I hope that I'll be able to see you again in the future when we take a deeper dive into this topic.
Wonderful. Thank you so much for the great questions from the audience and for Jean for the great presentation and Q&A. Thank you everyone and we look forward to seeing you next time.